Today I'm going to get a rhinoplasty. I can't believe that it's actually happening, and today's the day. I've been waiting for this my whole life.
When Justin came in, he had numerous concerns with his nose. One, he had a hard time breathing, on the right side especially. Two, he didn't like his profile. And three, the real question was, can you make my tip smaller but more symmetric?
One nostril is closed, so it's deviated. So when I sleep at night, I'll drool on the pillow or snore. And I also like to swim a lot, so when you're swimming, you have your head down in the water. You go to turn the head to the left to breathe, and then you're supposed to take a breath through your nose, but I can't because it's clogged.
One side of his nose was higher than the other in regards to the alar base. His tip was extremely asymmetric. The middle vault of his nose was narrow. He had a large hump. He had a bad deviated septum. He had a difficult nose.
I chose Dr. Nassif for a couple of reasons. I did my research, I looked online. Dr. Nassif has great reviews. He also made me feel very comfortable when I spoke to him. He also made it seem to me like I didn't have to get it done. He wasn't put any pressure on you at all. He's very down to earth, I would say. So choosing Dr. Nassif was the best thing I could have done.
Once we started surgery with Justin, our goal would be to, 1, to improve your breathing, 2, to soften your profile, 3, to make the tip better, smaller with preserving the structural integrity for breathing. The initial procedure was the septoplasty and the rhinoplasty. Following that, we performed the open rhinoplasty, which included removal of the hump, placement of spreader grafts to prevent an inverted V deformity, and to contour and make the tip smaller. But again, the goal with the tip was to make it smaller without compromising the integrity of the cartilage that was there. We don't want to have any nasal obstruction down the line. We've just finished Justin's surgery and everything went great, and I know that Justin is going to be extremely happy with his result.
It's been about 6 months since I had my procedure. Extremely happy with the results. I think Dr. Nassif did a great job. I could actually breathe when I exercise. Basically, the profile and the look of the nose also came out great. I mean, exceeded my expectations by far.
Today, Justin came in and I was very happy with his nose. His airway looked great. His tip is better and softer. However, he still has a good amount of swelling. It's going to take a full 2 years with this thick nasal skin on his nose to heal. His profile looks great. It's very natural. So I'm extremely pleased, and I know that his nose will continue to get better with time.
I swim a lot, and you turn your head, left to right to take a breath. You actually get a breath of air now instead of being clogged up. But also snoring. I used to snore really bad. My girlfriend would always be like, hey, put something in your mouth, and now it's all good. No more drooling either.
Mr. Justin.
How you doing?
How you doing, buddy?
Great, how are you? When you come in to see Dr. Nassif for the follow-ups, he cares a lot actually about what you think of it, of how it's functioning, plus make sure that everything's healing right, because it wasn't, and he takes care of you right away.
What's really important though is to keep your follow-up appointments. I want to see patients during that initial 6 months of healing, and I especially want to make sure that there's no swelling or scar tissue that's building, because at that time I can treat it. So it's very important when you have a rhinoplasty to keep your follow-up appointments. Your profile is absolutely perfect.
I love it.
This is a home run. Let me look inside your nose.
Having my surgery with Dr. Nassif was actually a pleasure. He not only makes you feel really comfortable, he gets kind of friendship before even the procedure, and he can, joke around with you a little bit, but at the same time maintain the professional level.
Taking photos of a patient's postoperative healing course is extremely important. It gives me a chance to sit and look at how the patient's nose looks at 1 month, 6 months, a year, so I can fully evaluate what's happening or if there's any issues or items I need to address. It's interesting, when I look at someone's nose, I may see things better when I'm seeing it on camera. So if I'm looking at you right now, I might think it looks great, but then if I take a photo and put it on my desktop, I might notice some irregularity that I'm unhappy with.
Overall results, I'm so much more confident. I have like more of a backbone about my face and my character. I'm smiling a lot more. I'm just overall, it changed my life a lot.
by getting the surgery, and I think that the results came out wonderful.